Assalamu alaikum. In this video, we will be covering the proper guidelines to identify and triage patients with suspected Ebola virus. Currently, there is the biggest and most complex Ebola virus outbreak in history. The seriousness of the epidemic is made worse by the virulence of the virus. The high case fatality rate in this outbreak is about 50%, and the symptoms of the disease are dramatic. These include hemorrhaging, vomiting, and diarrhea. Therefore, a coordinated public health response is essential to slow and ultimately reverse the spread of the Ebola virus. The Kingdom of Saudi Arabia is preparing for the unlikely event of an Ebola virus outbreak. As people travel, the microbes within them travel too. It is important to take a full assessment, including which countries the patient has come from, visited, or been in contact with people from high-risk countries. These are updated on the World Health Organization website. You may encounter a patient who is infected with Ebola virus. The Ministry of Health has developed guidelines to efficiently identify and triage patients with symptoms that may be indicative of the virus. A physician or nurse wearing personal protective equipment should complete clinical triage to quickly identify patients who meet the clinical criteria. These include all symptomatic patients who have been in an area where Ebola virus transmission is active over the past 3 weeks, namely Guinea, Sierra Leone, and Liberia. Also included are those who have had close contact with someone who has or is suspected to have the disease. If a patient meets the clinical and epidemiological criteria to be a suspected case, they should be immediately put under contact and droplet precautions. Next is to contact 937 immediately to verify the suspicion with the 24/7 on-call ID consultant. Medical assessment, including a blood test, should be minimized and tailored to patient needs till he is transferred. If viral hemorrhagic fever is suspected, the epidemiological investigation form should be completed. Ebola infectious disease consultant will be supporting physicians through the Ministry of Health 937 hotline. If the patient's condition is too critical to allow for transfer, then he will be admitted to the isolation ICU under droplet and contact precautions. Otherwise, any suspected patient should be transferred immediately to one of the Ebola centers of excellence. King Fahd General Hospital in Jeddah, Prince Mohammed bin Abdulaziz Hospital in Riyadh, or Dammam Medical Complex in the eastern region. We are prepared to respond to an Ebola virus disease outbreak or any other similar challenge to the health of Saudi Arabians and our global citizen guests. Working together, we can make sure that even in the event of cases of Ebola virus, the risk is reduced to the most minimal levels.